Good morning. Welcome to Managing the Fear Curve, real-world tools to help teams deliver in times of crisis. This is the second of DBIA's new webinar series to help us navigate the uncertainties in our industry and in the world brought on by COVID-19. I'm Christine Williams, Special Projects Manager at DBIA. These sessions have been designed to specifically address the challenges we know our industry is facing during these uncertain times. Our speakers are among DBIA's most popular course instructors and conference presenters who've offered their time and expertise to help us navigate this uncertainty. Before I introduce our speakers, I want to offer some basic rules of the road. We will take questions throughout this session. Please use the Q&A section of Zoom to post your question. We will also email you a copy of the slides in this presentation. An attendance certificate for CEUs will be emailed in a separate email from the Education Department within a couple of weeks. Today's webinar is a continuation of our conversation on Friday. We're happy to reintroduce you to Dwayne Abels and to welcome market intelligence expert Keith Prather, both with Pioneer IQ. They'll give us their insights and some tools we can use to manage the fear and unknown we all feel in this COVID-19 world. Thank you to Dwayne and Keith for joining us today.
All right, I'm good to go. Okay, good morning. Dwayne Abels here. I hope this is finding you well this morning, that you are healthy and motivated. We are in what we consider the third inning right now of a big game that all of us are living right now. Over the past 3 days since Friday, this is a continuation from Friday's series. Over the past 3 days, I got to tell you, I have been reminded by numerous emails and phone calls and stories that I've heard Friday, Saturday, Sunday night, yesterday, early this morning. We have the absolute best support around us as a community. When I look at who was on the call Friday, when I look who's on the call and the webinar this morning, when I hear some of the stories that have been taking place, it's a reminder that there isn't one single person in our industry that's alone. Being alone is a choice, and I refuse to accept that. I feel that in and out through certain parts of the day or night. And when I do, I quickly pick up the phone and call somebody, even some people who are on the webinar here this morning. Please don't feel alone. You're not alone. We have some of the best owners in the business on this call in our industry that are available. May not be available at the exact time, but are available to help out and provide insight. We have professionals, we have consultants, we have architects, engineers, contractors, specialty trade people. We have legal folks, we have economists, we have CPAs. All the assets and resources that you need are available to you in the industry. Please access them, because the truth is you are the best person to make the best decision for your team and for your company right now. Our job as professionals, other peers that you might have, our job is to help equip you and provide you with some frameworks and some thinking and some insights, but ultimately to provide you with enough data so that you can make the best decision for your team. There is no perfect answer. We're all going to fail and make some bad decisions. This is uncharted territory, but we have to make the decisions. What I have learned on top of what I just communicated is that the natural instincts of most people is providing them with clear direction, but they aren't able to get enough data to back them up. Right now, you may not get enough data. Hopefully through this webinar, we're able to provide you with two things, a framework and some data to help you start to time out how you think this might work and how your market might respond over the course of the next several weeks. And we're also able to provide you with a framework that is going to help you to understand how to prepare your team and to plan and to innovate and to prioritize and to start to deploy your team so that your team is in position to serve the greater needs of your marketplace and of your customers, and can continue to grow through the process of the whole development of the current situation. Again, this is a continuation from our last session, In our last session on Friday, that was all about how to effectively lead yourself, lead those people who directly report to you who are on your team. We then got into some specific things that it takes for us to update our plans and to effectively lead our small group and team, and then to empower our team to serve our clients today, tomorrow, next week, as we move through the crisis. This particular session here is going to be purely around what it takes to help you to effectively lead your team. We're going to provide you with that framework around how to more effectively, more calculated, genuinely guess on what you think the timing of your market is going to be. Keith is going to talk us through that. And then secondly, I'm going to come back and provide you with a communication framework and a strategic planning framework so that you can take some of these insights and decisions, capture information from your customers, employees, apply that to some clear innovation and a plan, and deploy it. I'm going to introduce Keith to you right quick. Keith Prather is the founder and managing partner of Armada Corporate Intelligence. They are a business partner of ours. We genuinely have a design-build relationship, if you will, so that we can provide a collaborative, quicker, more efficient data and process to our clients to help them with understanding the right market intel to make decisions about their clients, their markets, new industry sectors to get into or to get out of, or which ones to expand. He's going to introduce you to the growth curve. Keith is a personal friend of mine as we've developed our relationship over the last 16 or 17 years, and is globally known in many circles with executives and associations and the market intelligence community. Keith, I'm going to hand it over to you to give us the overview of the fear curve and how to make decisions on the timing.
All right. Good morning, everybody. Hope you can hear me okay. So what I wanted to do is just kind of start a little bit by just explaining that, over the last month, as COVID-19 has kind of, started to run its course, we have been asked by a number of CEOs, folks all the way from Fortune 500 companies to, as Dwayne said, some of the national associations that are out there to try and figure out, how this thing plays itself out. And primarily what they're interested in is, when can we get back to work? And when we watch, Fox or CNN or whatever your, favorite flavor is, there's a lot of different estimates out there. So we hear some sensationalized estimates saying that, we may not get back to normal until Q1 of next year. We hear others saying, man, we should be back to work right now. And so what we like to do is, I'm an analyst, and so I go back in and I look at all of our intelligence frameworks, and I, use real data to try and triangulate and figure out where we should be. And so we developed this thing called the fear curve, and the fear curve is just simply that. It's understanding sort of the fear in officials, in your minds, in everyday, average citizens' minds, because the fear curve really helps dictate when economically we'll see things start to rebound. We'll start to understand, when, state and local county officials start to release, work, start getting people back on the job and start getting the economy rolling again. So what I want to do is just start off on the next slide by taking a look a little bit back in history at 4 different examples. So Dwayne, if you'll just forward that for me, there we go. So what I want to do is just start with China for a second. And you guys who are living, eating, and breathing, news, this is going to be hopefully something a little bit different than what you've been seeing. But the point here is that if you take a look at the China curve, which is where the virus started, what we're looking at here is, and all I want you to focus on, because some of the data here is a little bit hard to see, but all I want you to focus on is the orange curve. This is a logarithmic curve, and basically what this is just helping us understand an order of magnitude of basically how the number of cases of COVID-19 grew in China. And despite of what we think about, sort of the challenges China was under, I mean, if you think about it, they had to grapple with the fact that they didn't know what they were dealing with early on. So as they went through December and January, and they had just a handful of cases on their hands, they really didn't know what they had. And so they did some of the unthinkable things, which is completely shutting down an entire city or completely shutting down an entire province, and doing things like unloading and dumping loads of dirt on roads to prevent people from leaving cities. So they were forced with having to do the unthinkable. So here's the optimistic side and the reason why I wanted to show you the data. If you take a look from January 21st, when the number of cases in China started to go exponential, started to grow, it took about 27 days before that curve started to flatten out. And China's curves continued to flatten. If you take a look at that little bitty thumbnail up at the top right, the data is not important. What I want you to do is look at the size of the columns, and you can look and see that China's caseload on a daily basis kind of spiked in the middle of February, and then as you can see that as the curve flattens out, they get very few daily cases of the virus. When we look at statistical data here, then, and you take a look at the number of confirmed cases, they have about 82,000 confirmed cases. And I got to throw in a caveat here for just a second. So I put this together yesterday for DBIA to try and get it in so they could do some work on the PowerPoint itself. And so if you're out there like staring at the Johns Hopkins University website, these numbers are going to be just slightly different. They're 24 hours old, and that'll tell you kind of how fast the market is changing. But confirmed cases, we had about 82,000. Confirmed deaths from COVID-19, about 3,000. What I wanted to point out here and hopefully make us feel a little bit more comfortable is the fact that even in China, where they had a difficult time actually controlling the virus, they have just a 0.006% infection rate among the population. Even if we take that and we say it's by an order of magnitude, it's off by 10 times. And that there are 10 times the number of cases that went unreported. When we really think the real number is about 4 times, it's still an infection rate of just 0.059%. So the infection rate for COVID-19, especially in China, is very, very small. The mortality rate in China was about 4%. And then at the bottom there, you can look and see in comparison to the global rate, global confirmed cases as of yesterday were about 745,000. I can tell you this morning, they're about 803,000. So they grew about 70,000 overnight. Global deaths, about 35,000, a global mortality rate of about 4.7%. But let's take a look at someone that's been in the headlines on the next slide. Let's take a look at Germany for a second, because Germany generally has done this right. And so what's happening here is that if you take a look at Germany's issues, Germany kind of contained the virus at first. And if you look, they were able to keep the number of cases fairly flat. So their curve remained flat for quite a while, but then it broke out around February 25th, and they lost containment, and then you see sort of the secondary spike. If you take a look at the upper right, you see the daily cases again, surging again, but starting to maybe flatten off a little bit as they start to get a little under control. But what's been interesting is that the healthcare system in Germany has been able to keep up with it. And so right now they've got an infection rate of about 0.077%. Suspected infection rate of about 0.772% if we carry it higher. And I did just see a comment a little bit that some areas are reporting that infection rate may be 15 to 40% higher. Even if that's the case, Germany's suspected infection rate is only going to be, somewhere around 3%. So still a small fraction of the population. The mortality rate for Germany right now about 0.9%. So quite a bit less than what we're seeing, at least on a global basis. Let's go to someone who didn't get it right. Let's take a look at the next one. Let's take a look at Italy. And so, Italy did not work hard, at least early on, in containment, had some issues trying to contain the virus itself, and saw the exponential spike. I did go ahead and circle and acknowledge the fact that there was some improved testing going on. But as that spike continues to go up, we see right now that they're currently about 37 days into their virus outbreak, when it went exponential on them. And so we've got about 97,000 confirmed cases. The mortality rate here, because they didn't get ahead of it, was about 11%. So this is the big issue, and the reason why, at least at a federal level in the United States, we're trying to really contain the virus, because they see what happens. They see what happens to the mortality rate when they let it break containment and when they can't control it. And so that's the reason why we see the country generally shutting down almost everywhere by now. So again, about 37 days from start to finish. So now let's take a look at the U.S. So in the United States right now, we have roughly, about 144,000 cases this morning. When we got up, it had risen by about 20,000. It's now at about 164,000. Number of deaths was about 2,500. As of yesterday, it's about 3,100 this morning. The reported infection rate is about 0.044%. Suspected infection rate still under 1%. Even if it's, an order of magnitude, 2 to 3 times higher than that, we're still roughly just 1%, with a mortality rate right now of about 1.8%. So if you take a look, our curve is still going up as testing improves and we get more tests in more areas. So the number of cases is still rising, but if you take a look, we're about 34 days into essentially what has been sort of our logarithmic period, right? And so the reason why I wanted to show you these first 4 slides, just to sort of set the stage for our discussion here today, was just to give you an idea of, what we're looking at worldwide in the number of cases, how that curve starts to flatten, whether we're talking about a worst case scenario or even a best case scenario. We can start to put some timelines around it. And at least for now, it feels nothing like, 6-7 months from now. It feels more like we're counting it in terms of weeks, perhaps maybe just a little over a month before we start to see, the number of cases really come off. So if you take a look on the bottom right there, I just gave you a little bit of an idea of what the mortality rate comparisons look like. A lot of health officials, right, and guys like me, for whatever reason, we feel like we're virologists now, right? And we're far from it. But when you listen to the CDC, you listen to the WHO and some others, what they're really watching is the mortality rate. I mean, the number of infections is important, but when the healthcare systems can stay ahead of the virus, they're able to control it, at least to the degree that they can keep the number of deaths down. So when you look at South Korea got it right. Mortality rate is about 1.6%. You look at the UK is struggling, even though this number will come down as additional testing is able to take place. The same in France. The mortality rates there still a little bit higher than what we would have seen anywhere else. We never really saw the U.S. mortality rate get that high even early on before we had some dramatic increases in testing. Spain at about 8%, still out of control. But look at Canada. Canada about 1%, and then Mexico about 2%. Mexico's case is still growing at a fairly controlled rate, but the reporting and testing conditions in Mexico not as good as they probably are in the United States. So it's just to give you an idea of kind of where we are. So taking all this information together, what we produced was a thing called the fear curve. On the next slide there, Dwayne. Thank you, sir. So the fear curve then is not an economic prediction per se, okay? This literally is what's between the ears of government officials, corporate executives, et cetera. One of the things that we want to look at is sort of how that fear curve works and when it peaks, when we can kind of expect the marketplace at least to start to see some hope, to start to see some optimism sinking back into the market, and to get to the point where we go back to work. As Dwayne said, a lot of people are talking about it in terms of a baseball game, and we're talking about 9 innings. And so today, or as of Friday, we felt like we were probably in the 3rd inning of this game, and we're still climbing sort of to this crisis peak. We still see some pretty morbid things out of New York, and we see, challenges, growing in Chicago and Detroit, LA, Louisiana, a lot of places in the country with heavy population densities, starting to see increases in cases and seeing some challenges in hospitals. And so that creates additional fear. And so we've still got probably at least, we think maybe 2 more weeks before we can start to call it a crisis peak. For those of you who have ever had an emergency situation out in a remote area, that 911 will typically use a triangulation method to try and figure out where a cell phone is, especially if the person can't talk or can't describe where they are. So they'll take 3 towers, they'll take the actual cell phone, and they do triangulation to be able to pinpoint where they are. this fear curve, what we've done is we've tried to do the same thing, where we've tried to use 3 or 4 different sources of information to try and get to a triangulation of what actually should happen and how this should play out. Okay. So what we've got is, we believe that right now we're probably in the 3rd inning. We believe that a 4th inning is coming pretty quickly, but by April 13th, we think the crisis peaks. A couple things that make that happen is that we will have had continuous testing and on a pretty broad basis, so that we'll have a baseline of cases. We understand sort of what the number of cases in the United States is, so that then when we get new daily rates, we can look and see what the real growth rate of infections are, and that's what really matters. Are we getting ahead of it, or are we losing ground to it? And right now, it looks like we're probably getting up to that peak, and we're going to get over it. There's also, as you guys know, if you've watched a little bit of the news, that there is a tremendous amount of testing of therapeutics in the marketplace. And so we're seeing, chloroquine and hydroxychloroquine, 2 drugs that have been used for malaria since the 1930s. And those 2 drugs combined with like a Z-Pak or an antibiotic has been showing at least some positive results. In fact, so much now that the drugs are becoming difficult to get a hold of. But there's this correlation between therapeutics being tested and finding that they work on the most severe cases, and us getting back to normal. Because a very small fraction of the population is actually getting a severe enough case that they have to go on a ventilator. If we can prevent anyone from getting to that ventilator stage, then we almost get that, nationally, let's go back to work kind of moment, where if you do get tremendously sick and you do go to the hospital, regardless of age or underlying conditions, it's time to go back to work. We can get you into the hospital, and we've got therapeutics that hopefully will get you over it. So that's where sort of the fear comes down, and we start to see, as these market tests start to emerge, you start to see optimism build. You start to see some counties in the country start to go back to work. And so sometime in this, 2nd to 3rd week of April, that's when you start to see some of these localized restrictions start to loosen, and we probably start to see a lot of construction projects start to refire. We start to move again. But I'll just point out 2 more quick things, and I'll pass it back over to Dwayne. There's always a flattening when you get a bunch of optimism and we start to feel better. Typically, there's a little bit of, too much hype or too much positive expectations. We get a little bit of this swoon, and that swoon kind of is going to come in sort of toward the end of April, early part of May. But then we're going to get additional proof that therapeutics are working. We know that there's a little temperature sensitivity to the virus. Containment efforts are starting to work. And then in May, we really come off that peak. What I do want to point out, and I hope you guys will go out to the CDC and listen to what they're saying, but about a month ago, the CDC issued their order banning gatherings of 50 people or more, right? That's when we saw the sporting world shut down. They still have that deadline set for May 15th when that order supposedly comes off. Now, it can be extended, but the bottom line is that they have used their scientific engineering and their modeling to be able to circle May 15th as kind of that point when they feel like things start to get a little bit back to normal. These are estimates that could be totally wrong, but for now, this is kind of the best we have to work with, and hopefully it gives you guys a gauge of, when we can optimistically feel like we can get back to work. It's not going to be January 1st, like some people are trying to tell you, and there's no proof to say that 40% of the population is going to get it based on cases we see around the world and some of the best data reporting environments around the world. It feels like it's still going to be a small percent of the population that gets it, and we kind of have an idea now of what that therapeutic impact is going to be and when we can kind of get back to work. So, all right, I'm going to hand it back over to Dwayne then for now, and be hanging around to answer any questions you guys have. We'll see if we can compile them.
Yeah, so if you have any questions, use the Q&A area of your screen down below. Keith, one of the questions that popped up that I saw here that came in on a text messaging was, is this fear curve a national fear curve, and does it change by different geographic area or region?
Fantastic question. Yes, absolutely. This is national fear curve. Okay, and on a local basis, you've got complete counties and communities that are going to be just a flat line at the very bottom. They're going to feel, other than an economic impact, that this virus has completely missed them. And so yeah, it's absolutely by county. And there are ways you can take, like the CDC maps. If you go on the coronavirus map at Johns Hopkins, you can actually look at it at a county level. So there's resources out there that you guys can go look at to understand sort of where your construction projects are, where they're going to be, and you can look at the case count and drill into that coronavirus map and understand at least what that county is dealing with. And maybe what that county is expecting as far as growth rates on those curves. But fantastic question. And yeah, this is just national level stuff and just US right now.
Next question that came in, is the fear curve directly correlated with the number of confirmed COVID-19 cases?
It's not. When we first designed it about a month ago, it was not. But there is a brand new resource out there, and I would encourage you guys to go take a look at it. It's, let me see if I can pull it up here real fast. It's the, hold on a second. It's IMHE, which is the, I'm going to find it. Give me 1 second here. So it's part of the University of Washington, and it's the Institute for Health Metrics and Evaluation. And so, separate organization, and they just created what they believe is their case peak and what they see as the impact on hospitals and hospitalization and the need for ICU rooms and the need for ventilators. And what they are projecting is an April 15th peak. So that would, if you are interested in going out and looking at the actual case numbers, I'll try to make the information available through DBIA, but also you can go out to it's the Institute for Health Metrics and Evaluation, and Dr. Birx, you see in the White House Coronavirus Task Force, she referenced IMHE also. And so anyway, their information has just recently come out, but it seems to correlate fairly close to our curve. And it was just complete happenstance. So it's a great question.
Another good question. Shane's asking, what's the likelihood of another spike in the curve? Would it be similar to the one that's shown or something potentially different?
Yeah, I mean, what they're trying, it wouldn't be exactly like this curve, but Germany is a good example. And the reason why I pulled Germany is because Germany's experiencing just that. Germany thought they had it under control completely, and then it broke containment, and now they're working on getting it back under control. And so, when we think about the German curve, you're talking about roughly 32 days from the minute they thought they had it under control until they're able to finally see the curve flattening a little bit again. So, it's interesting. And Thomas Sandell right there. Thank you guys. Thanks, Thomas, for posting that for everybody. But yeah, so I feel like it can break back out, but the curve won't look like this again, especially because our curve is designed based on what we think are strong therapeutics that work coming back into the marketplace. So those who get a very severe case or very sick, which is a small percent of total cases, then we'd have something to treat them with in the hospital. So,
Keith, a couple of questions that I've had texted to me while we're talking, and a few emails that have come in. Talk to us a little bit about how this could drive opportunities in the marketplace that could increase the demand on construction and the volume of construction coming out of this.
Absolutely. So, what's happening, especially in the global supply chain right now, is that a lot of weaknesses in the way we source products are actually being understood now. For China and anyone sourcing 100% of their products in China, this is now strike three. This is the third major event in about 36 months that has left the supply chain scrambling to try and find additional capacity. And so even though companies who source in China today will never, ever 100% leave China because it's too big a market to ignore, we do believe there's going to be a tremendous amount of reshoring and a tremendous amount of nearshoring in the USMCA markets, so the old NAFTA, right? You're going to see a lot of reshoring back into the United States where we increase manufacturing activity here. So you are going to see everything from healthcare and pharmaceuticals to just everyday consumer staples type products, coming back to the United States, and then also heading south into Mexico. And Mexico on a global basis is strategically set up so that it can become kind of a global center of manufacturing. And so they've got a lot of opportunities if they can get some challenges that they have fixed. And so yes, I think from a construction perspective, once we see the virus, as we come off this peak, as the fear curve starts to come down, I do believe in a short period of time, you're not only going to see a resumption of existing projects in a market and an economic condition that was creating a tremendous amount of demand for everything from residential construction to commercial construction, as you guys know, but then moving forward, it's going to create a brand new wave of brand new projects that did not exist before, with companies trying to get their global supply chains figured out. So it's a long way of answering that question. I apologize.
Yeah, I dare to say this in public, but I'm going to say it anyway. Keith, correct me if I misstate this, but with a lot of the customers and leaders that we've been working with in the design and construction industry, which is the only people that we work with, we have been trying to warn people that we think there could be a pretty significant construction tsunami that happens sometime in the third quarter and extends on for quite a while, because we have so many projects that are being slowly postponed or being slightly delayed, and then we have project starts that are being pushed back and delayed. And on top of that, just the absolute changing of how facilities are being used or not used is driving some opportunities as well. And then the fourth driver would be some of these new opportunities that are coming back onshore from the manufacturing market and distribution lines. Is that true, Keith?
Oh, absolutely. Yeah, everything you said is right. The other two things I would throw in there is that you've got, historically low interest rates, and you've got a tremendous amount of liquidity. It's been pumped back into the market. And so for those who have been thinking about a project, but maybe the timing wasn't right, the timing's becoming right, at least for now. So a lot of that will also depend on, we're going to see some commodity compression and maybe a little bit of commodity inflation coming up. But generally, yeah, absolutely. I think over the next 12 to 14 months, I think it's going to be great.
Okay, thanks, Keith. I'm going to transition into how we digest this information and start to make decisions for our markets and our teams, and then figure out how we start to develop a plan so that we can be in position for the short-term changes and impacts, and also the mid-term changes and impacts. One thing that's really important to mention is that this, again, is a national curve that we've created. What we are strongly suggesting people to do is to dig into other data that they can access to help them understand how to tailor this growth curve for their geographic market and for even some of their industry sectors that they're serving. We've been doing this for the state of Texas and Oklahoma, California. We've got several clients in Seattle and Florida, all over the U.S. This model looks differently. The fear might be less. In some cases, it may be a little higher. Some cases may be drawn out a little bit further, or contracting a little bit with time. But you've got to start to make some decisions for what you believe is going to be a general timeline for your markets. Again, no one's perfect. Nobody's making the exact, accurate, 100% accurate decisions right now. It's all the absolute best guess and best decision that everyone has with the decisions to make the right decisions. So what I want to be able to do is to put a strategic planning framework in your hands so that you can start to engage your team, capture how the needs of your customers and your prospects are starting to change, how they're starting to change, start to download that information with your team, make decisions, innovate so that you can start to deploy holistic solutions that serve your customers today, tomorrow, next week, next month, and especially as we start to see the growth curve start to flatten out and hopefully go away. I'm so ready for this to go away, but it provides an opportunity for us as leaders that is very rare. NFL players sit around and dream about and prepare for and live their life focused on the greatest event in their career, which is essentially a Super Bowl. I wouldn't dare compare this to the fun of the Super Bowl, but the intensity of the Super Bowl for us is essentially what it boils down to. If you are a leader, if you're an existing leader, if you're a mature leader, if you're an emerging leader, if you're someone who may not have the title or the shares yet, but you have a desire to step up and be a leader on your team, there are very few times in your career that are going to provide the opportunity that we have right now in front of us. So what I want to do is walk you very quickly through a planning infrastructure that will very quickly allow you to assess, allow you to discover, define opportunities, develop solutions, and to deploy them very quickly over the course of the next several weeks so that you can quickly move your organization and start to deploy teams. The design build process and community was made for this. No one's operating alone. We have several different teammates and partners that you can pull from for your team, your solution. This is a planning structure that we'd recommend to help you quickly do that. So I'll walk you through some specific things that you need to be considering as we're walking through the timeline in your market. So first thing, you'll want to make a decision for what you think the timeline will be in your market, and then I've overlaid for you these 4 different phases of crisis planning so that you can quickly deploy. So the first one is all about discovering. Here's the truth. We are all in business. We all exist to serve the needs of the community. The owners that are on the call, the owners that are in the Design Build Network, the owners that are in our community, they are there to serve the needs of the citizens in their community, or they're there to serve the needs and desires of their customers. Our job as design professionals is to genuinely support them and provide them with the right answers to questions that are popping up. Questions are popping up now faster and more intensely than ever. So the question is how can we quickly engage our team, not just the top leaders, not just the top business development people, but how can I as a leader, how can you as a leader deploy your professionals, your design build pros, as I like to refer to them, and deploy them out to start to uncover the needs of your employees and the needs of your customers. Mission critical number 1, we've got to start to uncover before we make any other decisions how needs are changing. Your team, your leaders, your employees, your staff, your coworkers can absolutely not fully function and focus on your customers' projects in the marketplace until they have their current needs secured. Your first responsibility is for them. We covered that last week. Hopefully you're in the process of getting a plan in place for them. Secondly, as they start to get a work scenario worked out at home, which most people are getting figured out now with fun and pain, shifting their priorities back onto your current clients, your prospects, and your marketplace is critical. The first area that we need to focus them is starting to uncover the specific needs of their customers and on your prospects and marketplace. The other thing that I want to make sure that we're communicating here is DBIA and several other organizations have done a good job of quickly sending out surveys. I would strongly recommend that when you are assessing the needs of people that you personally know or that you have a relationship with, don't send them a survey. We do a lot of surveys. I'm suggesting to not do surveys. People need to hear your voice. They need to hear you say, we understand, we're trying to help, we're trying to figure out, we want to support you, and they need to hear you asking how it's affecting them and their situation. How's it affecting their customers? How's it affecting their business plan? How's it affecting their current facilities? How's it affecting their current projects, projected projects, or plan that contains projects? They need to hear you asking those questions. Secondly, there will be very few times in your career where you can deploy so many people from within your team to emotionally connect with the needs of your customers. Just don't allow the senior people to do it. Make sure that you're deploying other people from within your company and team to be able to do that. Next, make sure that as you're starting to collect data, that you get your entire team together on a webinar, and make sure that you are allowing your individuals and your teams to download the rest of the group on exactly what they're uncovering. Allow them the opportunity to voice their opinions on how critical those needs are. And together as a group, your job as the leader is to facilitate which needs are needs that your team is qualified to serve, because you're going to get a bunch of them. You've got to get them into a quick prioritized list so that you can determine which of those needs you're qualified to serve, which of those needs you're genuinely passionate about, and which of those needs you can be somewhat profitable at delivering to. Some of the needs that we're delivering to right now are not profitable, but they will lead to opportunities down the road, or they might even be immediately profitable. You have to make that decision for yourself, but allow your team to present the information, and as their leader, ask for their direction and advice and opinions. That information then goes into the second phase, which is all about equipping you and your team to define what you want to do with the information. Again, the whole objective here as a leader is to uncover how their needs are changing and then make accurate decisions with the data that you're providing. First thing that you as a leader need to facilitate with your team is, what is it that you actually believe about the impact of the coronavirus, and what do you believe is your responsibility to respond? A lot of people right now are not responding. That is a response. There are a lot of people now responding with every answer and with as much offense as possible. I value and respect that type of courage. You have to make that decision for your team. What do you believe is your responsibility to respond? Secondly, narrow it down to the top 1 or 2 specific greater needs that you've learned from all the insights that your team's gathered, but narrow it down to just a few. And those few you're profitable at, you're passionate about, and you're qualified to deliver to. Next, help your team understand the positive and negative impacts of what you've learned. The fun stuff is going to sound like this. We've discovered these 2 or 3 new needs with customers that we have and prospects that we know of. If we're able to serve those needs, we could impact them and their clients and their customers and their facilities in a completely extraordinary way over the course of the short and long term. That's the fun stuff. The hard stuff that us as leaders are faced with right now is, what's the negative repercussion? You could very easily start to uncover 2 or 3 trends with clients and prospects that help you to realize that they are putting things on hold, either immediately or in the near future. You are going to have to make a decision on what you do with the information. What you can't do is ignore it. When the leaders ignore information and questions that everybody on your team is asking, you reduce your level of respect from your team, and you drive fear higher with those whom are around you. Address it. They will love you for it. They may not love your answer, which in this time of leadership, no answer is going to get 100% love. But at the end of the day, you have to make the right decisions based on the data that you're given. So understand the positive and negative impacts. Next, go back into your existing plan and reprioritize your plan. It's really easy to run off the cuff and with no structure. It needs to be written down and in a place that people can stay focused and access it. So with existing growth priorities, my suggestion for the most part, not all of them, but for some of them, they probably need to go on hold for a couple of weeks. Some of what you might find out is that some of what you are actually intending on developing is really needed now more so than ever. The other thing that you want to think about when you're defining your priorities is to specifically define what the priority is, who's responsible for that priority, and specifically when it needs to get done. Again, these are minor details. These are really simple things that you probably already do, but leaders forget to do when we're running as fast and hard as we are right now. Next, this is mission critical. Please keep this in mind and do this. We are finding that teams that are staying the most consistent and that are responding the best to change and have the least amount of fear are teams where their leader is keeping a consistent cadence in place. This is mission critical to the psychological behavior and focus of your team. Your ability to keep a consistent webinar or call or conversation with your team as a whole helps them to subconsciously understand and feel normacy and repetition and frequency. Make sure you're implementing that cadence so that you can capture insights on a daily or every other day basis. At minimum, it's got to be a week, within the week. But you've got to maintain that cadence with your team so you can understand what they're learning. You can respond as a team with solutions, and you can start to think through how you want to respond to your clients and customers. Next, you've got to communicate. Huge opportunity, again, for leaders extrovert, introvert, doesn't matter. The bottom line is that we have to start to communicate. We have seen clients do some of the most extraordinary things with no cost, no video companies, and the basic apps that they can access from their computers at home. What I have seen to be the absolute best practice is people taking iPhone videos or taking Loom videos, LOOM.com videos, and taking a 3 to 10 minute video and communicating out to their teams, to their whole organization, all their internal audiences, what they're finding from the client and prospect discussions, how they're prioritizing those needs, priorities that they're shifting and changing, and continuing on with next steps so that everybody's on the same page. Your job is to connect every single human being that you have invested in your organization to what you are trying to do. You cannot afford to have any expert, any professional on your team that's not clear on the current mission and how they fit into it and what their contribution is. Communication is the key to that. Now we get into the third phase, and again, as the swoon potentially starts to happen in that 7th inning that Keith talked about, this is where we as leaders have to rapidly start to make decisions on the fly. Again, we're going to have limited data. Nobody's decision is going to be perfect. You can do this. You have a lot of people surrounding you to access intelligence to apply to what you're developing. First, I'm challenging you. Matter of fact, I'm going to beg you. This is an opportunity where your organization and your customers and even your marketplace is going to quickly accept something very innovative or inventive. Your team, and I would be willing to bet you a steak dinner if I could buy it for you right now, that your team has ideas and innovative thoughts that you can quickly deploy that they've been sitting on, but they've not had the time, or maybe the culture wasn't right for them to communicate that, or for them to feel confident in communicating them to you. Push your team. Get them past surface level answers. Dig into how can we innovate and not imitate? How can we invent and not imitate? Hopefully they're able to quickly assess the information and be able to provide that to you. Here's some specific areas where you want to dig in. Look at your current toolbox. Look at the specific tools and services that you provide to your clients from a planning or design or construction or trade perspective. And then ask your team, based on what you found, how can we provide a more holistic solution based on what our current customers and our prospects told us? How can you make it more holistic? They probably already have an answer. The good news is you don't have to have one. They most likely do. Lean on them. Secondly, look at how you could easily change your customer's experience to add things early on to help your customers very simply assess their needs, help them to prioritize, help them to understand what decisions are more critical and what need to be made in order of priority, help them understand how their decisions are going to impact their timing, the cost, the actual project or what's put in place, how it could affect the quality of the building, how it could affect the quality of the project, the end user, the whole gamut. They need those answers from you. How can you quickly start to change your customer's experience to be able to provide that? Next, you've got to be able to engage them and tell the story. Go to your marketing department, go to your branding experts, go to your experts, for Pete's sake, if you have them inside your company, and help them help your team develop a story that communicates what you started to uncover, how you developed the solution, how you want to help them implement the solution because you understand their needs, but you got to have a story. Features and benefits is not going to work. We need engaging stories. Train your team, which will probably not take as much as you are thinking that it might take because they've been following your communication up until this point. Train your team and light up the marketing. The question that I would have you ask your team is, if you had the cure for cancer, how would you market it? Because right now, people have the same level of fear about their projects as they do cancer. And you have the solution. The question is how can you get it in the hands of those people? Your team, your millennials, your extroverts, your business development people, your advertising company. There are tons of people who can help you with this. Marketing the message is not complicated. You can do this. There's a lot of people to help you. The next question that we have to ask ourselves is, when can we deploy? Now. Now's the time to deploy. So at this point, you've discovered the needs of how your market's changing. You've narrowed down those needs into a 1 or 2 or 3 that you are passionate about, profitable at delivering, and qualified to solve. You've started to innovate and to create a more holistic solution, and you've tailored your customer experience, and now we've got to deploy it. We must deploy in priority. I would strongly urge you to empower your teams to immediately start to communicate their story back to those who they heard the needs from. The people that they called early on in the discovery phase, they should call immediately right back and help them to understand that they were heard, that you've developed a solution, and that you would like to help them understand how your team can help and support them. Current customers first. I would then urge you to look at past customers who are probably in similar situations, but may not have had an immediate project at the time that you last talked to them, but they may have bigger problems now. I would then urge you to think about warm prospects, people who you've had and been developing a relationship with. Reach out to them. Lastly, I would have you specifically as leaders start to think about what opportunities are going to begin to emerge in your community or in your marketplace because of the situation at hand. And those particular contacts are yours. It's really, really hard for us as leaders to not jump down and do everything for our team. No one's going to succeed every single time. We're going to fail. I failed this morning. I screwed up the WebEx here getting going. I had a heart attack, by the way. I failed last weekend. I failed last week. All of us are going to fail at some point, but we've got to pick each other up in the 2nd or 3rd inning so that we're not in a slump in the 4th inning. That's how team works. That's the beauty of design build. We're able to do this for each other and carry each other's flags as we move forward. So again, this is a really simple infrastructure to help you and your team understand how to quickly assess the needs of your customers and prospects in marketplace, innovate ideas, help you to develop leaders along the way, and deploy holistic solutions quickly back into your marketplace. All right, I'm going to open it up for some questions. Keith, if you guys are seeing some questions, pipe them back to me. One question that I have is now an appropriate time? I'm getting this question a lot. Is now really an appropriate time to call prospects? Here's my answer to that. If you have a clear purpose, if you have been able to define why your organization exists, and if it's for something greater than just making money, then right now is absolutely the time to call as many people as possible. I actually have a great client in Everett, Washington. I traveled there the first week of February, not fully comprehending everything that was going on, even though Keith was giving me heads up. I made the decision to go anyway. I communicated with my doctor that I was going to go to Everett, Washington to work with this contractor. And something amazing happened to me just out of the blue. Even after I had gotten back a couple of weeks later, I think it was the 1st of March, my doctor literally called me and said, "Hey, Dwayne, I know you travel. I know you went to Everett. I'm just checking in on you. How do you feel?" Do you know how great that made me feel? I don't have a personal relationship with that doctor, but the fact that he cared enough to reach out and to see how well I was doing, knowing what possible situation I could be in, your prospects and customers are the same way. They will appreciate your response. They may not get back to you effective, within 20, 30 minutes, but stay persistent. They need you. And now is the opportunity more so than ever to be able to reach out and help them. Next question, how do you set aside and balance Great question. Resources to apply to new innovations. Right now is a really tough time for leaders who are willing to face tough decisions. It could be that you have to put some of your team on a furlough, which is a popular term being used right now, or some other pay rate in order to help free up cash flow to continue running the business. Part of that freed up cash flow could be used to deploy it into a holistic, innovative solution. To be really frank with you, I have yet to see it take a ton of money to help innovate. Most of what we are seeing is something that is already an idea and is probably not going to take a significant amount of additional resources for you to be able to provide to your client, especially when you start to consider your design build partnerships and other people within the trade and supply chain of your partnership to be able to serve your client. So next question, what's the number one, I've had this question a few times. What's number one for me, question mark. The number one topic for you to focus on as a leader is employing or empowering your team to go out and understand how the needs of your customers and your prospects are changing so you can respond as accurately as possible. All right, I'm going to open it back up to Keith and I. Both, if you have any questions on economic trends or opportunities, we've got a few minutes left. Keith, are you still with me?
I'm here.
Okay.
Absolutely.
Excellent. So if you have any questions on the fear curve or the strategic planning methodology or anything that could fall in between, we've got a few seconds here, a few minutes here. Please feel free to type that out. All right. I'm working in New Orleans and have observed hundreds of construction workers performing work with minimum PPE, especially during breaks and lunch. How are construction companies protecting their workers? What's the plan? And are they potentially putting their families in harm's way? Great question. I've worked with two different companies yesterday on what they're calling Worksite Safety 2.0 for Corona-19. And what we have seen is that leaders now are putting forth more safety precautions on their job sites. We even have had one company ask their families to sew face masks and get creative with reaching out to the families of their team members. Face masks are becoming mandatory on a lot of job sites. Gloves are already mandatory for a lot of ways, but when you have on a face mask and you have on gloves, those two things simply can prevent people from touching their face or taking something in. I'm not a doctor, but I am hearing a lot of that. Obviously, some of the things like no meetings at job sites have been communicated and changed. So standing meetings 6 foot apart, etc. A lot of webinars moving forward. How best can we bring this to upper management? This recording is available. I'll also show you in just a second how your team can plug into a webinar series specifically on this topic. Has there been any discussion of how the economy will be opened back up? Will particular sectors be prioritized to come back to work? Keith, you got any insights on that?
Well, we know manufacturing is going to be top line. They're going to continue to try and recover. We know that obviously all the consumer staples products are going to continue to, start to ramp back up. But I think the biggest challenge is we've got to get what looks like could be 35 to 40 million people back to work. And so that's going to be restaurants, hospitality, and that'll be some of the first waves to try and get a lot of consumer spending, try to get income back in consumers' pockets. And so that's where you're going to see probably the first big waves, and it'll be district by district. Again, it's going to be county by county, district by district, the way this thing unrolls across the United States. So areas like New York that have been hit extremely hard, high, dense populations, probably going to be a lot slower to recover than, for instance, where Dwayne and I are right now, kind of out in the Midwest. So that's just kind of what I think there.
All right, we're running up against time. I am going to bring this to a close. Here's an opportunity. If you and your team are needing insights and information specifically on how to align the fear curve for you and in your markets, if you're needing to equip your team with insights and tools to develop a plan, we have been asked to separately provide a 6-week webinar series for companies. Anyone can join into this. It's separate from what we're doing here, but we've been asked to walk leaders through the next 6 weeks so that they can get continued trend information from Keith and I, economic information so that they can adjust the timing of the fear curve and the timing for them in their markets. And then secondly, we're literally going to walk through each week what your team needs to do in each of these 4 phases so that by the end of the 6 weeks, you're deploying a plan. That's an alternative webinar series for this topic to equip you with exactly how. If you want, need, or desire that, text LEAD ON to the number on your screen. Keep in mind, the DBIA also has a separate 3rd webinar, which will be coming up.
Thank you, Dwayne and Keith, for that terrific presentation. Again, we will be sending this webinar deck to registrants. We also urge you to join us for our next free webinar, April 7th, when leadership trainer and international author Brent Darnell will offer tools to help us manage stress to obtain our peak performance.